All right, what's up, everyone? So, those of you that joined right now, thank you for joining. I know I was out of commission for 2 weeks, so a big shout out to everyone's patience and well wishes. Thank you so much for that. Also for our team, kind of taking the role over as I was recovering severely. So I'm back to like 70, 75%, but I did lose a lot of weight, and my respiratory is still definitely struggling. So with that said, thank you so much. And but we do have a couple people here. Nurse Megan, where are you at?
Hello. Hi, Dr. Z. Hi, everyone.
Hello, hello. So Nurse Megan, let me give a little introduction. Nurse Megan is one of our top educators. Nurse Megan, you also have a master's in education, correct? On top of your
Mhm.
RN,
Yep.
and is one of our top tutors and educators, period. So, Nurse Megan, you want to just kind of give a little background on you, like real quick, so people can get to
Yeah.
know you?
Yep. So hi, everyone. If you don't know me, like Dr. Z said, I am one of our tutors. I am one of our educators. I do have a master's in education. I was part of the course, what, Dr. Z, almost 2 years ago now?
Yeah, like
Right?
give or take, yeah.
So I do know how everyone feels. I've been in your shoes. You are in the right place. So if there's anything I can do for you, if you have questions, I'm here for you. And you're going to pass the NCLEX and you're going to be on the other side before you know it. So,
Absolutely. And Nurse Megan, you do have a special going on as well, too, right?
yes, I do. I have I think it's the four.
Four for 250.
Yes.
Right?
Yeah.
Four for
Yep.
250. Yeah.
Yeah.
So
Yep.
if you're looking for a tutor, Nurse Megan's obviously one of our top tutors, period. So, and again, with so much experience as well, too. So Nurse Megan, it was always nice seeing you. And then tomorrow you're teaching what? Musculoskeletal?
Yes. Yep. I'm teaching for our course tomorrow. So those, if you're in here, I'll see you tomorrow. And if anyone else, ever needs anything, please reach out and let us know. Okay.
Email us. Absolutely. All right, Nurse Megan,
Yep.
thank you so much.
You're
Nurse
welcome.
Brittany, we have Nurse Brittany here, obviously, as well, too. Nurse Brittany is also one of our top tutors and top educators as well, too. But with that said, I'm going to, we have some people that made it to the other side. Nurse Stewart, did Nurse Stewart make it in? Yeah, maybe not. Okay, Nurse Stewart's
I
not there.
see that. I
Uh,
can see that in the names.
no. Okay.
Yeah,
And then did Nurse Hamisha make it?
I don't see them either.
Okay, well then we have two testimonials that we'll have to post on YouTube as
Yeah.
well too. So all right, cool. Let's get started on some pharm. Okay, this is the thing about pharm, and I want everyone just to kind of listen to me here and take notes at this point. Just pay attention to what I'm saying. Oh, I've got announcements. What am I saying? Hold on one second. All right, so we didn't do testimonials. uh okay, we do. Okay, so for those of you that are looking to test anytime between now and August, maybe even into September, you should be in at least a course right now or signing up for the July course. But more importantly, you should be doing our self-paced course right now. That's 70 hours. That's the entire course with the notes and everything. It is on special for $359.99 for 45 days. You should be on that right now if you're thinking about testing anywhere from now till I'd say almost August, September. Then our live course is now open for July. It is open. It is $499 right now. And it goes from July 8th to July 30th. The dates are right here if you scan one of these QR codes as well too. If you're looking for financial assistance letters, we've created one for you. So all you have to do is scan that code and you'll be able to download a template that we've created to give to your local religious community organizations, even work. I'm telling you right now, keep your receipt. A lot of hospitals, and ask them as you apply, will you reimburse me? And they probably will because there's such a shortage of nurses. They'll be like, all right, cool, we're not going to nitpick about $499.99. So again, really big to do that. Sorry about that. Okay. Then we do have tutoring available. If you scan the code, we do have specials going on with Nurse Brittany, Nurse Justin, and Nurse Megan as well too. But their time goes quickly, so there's only a limited amount of hours. So if you need to get in quick, order quick. If you got time, then you can always just do that and schedule. We have a ton of free resources. Utilize our free resources. I cannot begin to tell you, Ask Raf NIPA needs me doing practice questions like we're going to be doing today. Just in general, there's so much free resources, podcast, YouTube, Instagram, TikTok, so on and so forth. And then, okay, the last thing, and can we put this, Nurse Brittany, can we put the link in? Because I forgot to do that with the QR code. If you need to speak to me regarding an upcoming course, July course or on-demand course, I am now doing phone calls. I think I got enough energy to make phone calls. So I will be making phone calls. If I have not reached out to you yet, just plan on hearing from me this week. So you will directly get a call from me. So definitely fill out that Google form. And it's for people that are not enrolled in the course and or have questions about the upcoming courses. And then again, remember that there's a lot of scams. So we don't do Zelle, we don't do Cash App, we don't do Discord, Telegram, things of that nature. So obviously just be very, very careful. I've heard too many stories, especially if I've picked up the phone. Anybody actually talk to me on the phone here? Put it in chat, because I'm pretty sure I've made a few phone calls here that somebody has talked to me at this point. Yes, there you go. See, I've got proof that I actually do call. So now, what I want you to do is I want you to pay attention before we get into the question, because if the question comes up, the chat's going to go off and everyone's going to try to answer the question, but I want you to pay attention. So start taking notes right now. With Pharm, especially with your test coming up, now, I'm not telling you to only do these topics, but in order of what I think is highest yield, there's 4 topics that really have a lot of Pharm in it that the boards love. Cardio, endocrine, mental health, and respiratory. I'll say that again. Cardio, endocrine, mental health, and respiratory. So these 4, now these aren't the only ones. Of course, other topics, maternity, this, that, they have a lot of cardio, not a lot of Pharm, but these ones, they're like Pharm centric, right? Like there is some sort of Pharm that pops up with one of these 4, because you're talking about inhalers, things like that. You're talking about insulin. You're talking about all the cardio drugs that we're going to talk about quite a few today. You're talking about mental health. You're talking about depression, antipsychotics, things of that nature. So if you just kind of put it together, it's very important that those 4, if you're in a short bind, then that's what you want to do, okay? And if you are in a short bind, we do have that rapid review that that is $99.99. It's $99.99, and it's like 10, 11 hours of handpicked topics that I think are like, if you're cramming, that'll be the best for you. Or you can start there and always upgrade. So that's the first thing I want you to know about Pharm, is the ones that are like super just dense in Pharm. The second thing I want you to know, and again, write this down. How do they ask Pharm questions? It's a quick tip, right? It's a quick tip. And actually, I didn't put it on there, but let me pull it up real quick. It's in here, but nonetheless, Pharm questions, they're not as complicated as you think, but people ask me all the time, Dr. Z, like, do you even teach Pharm? And I'm like, yeah, I do. But I do it with each disease process. And that's how you should learn it. You should learn it as a progression. If I'm learning about Pharm, I'm not going to just do diuretics. I need to know that I'm in heart failure and I'm using it in this situation, or I'm in depression and I'm using it in this situation, because otherwise you're just memorizing pharm. That's it. So understanding where it's used is very important as well. There's a few ways I can ask a pharm question. Is, well, identifying it. Identification is huge, which is a freebie type of a question, one of the 5 types of questions. It could be a select all that apply with education. Good job, yeah. With education, side effects, contraindications, which would be a freebie question as well too. So there's not really a lot of ways that I'm going to, further teaching for the intervention, good job. Yeah, there's not really a lot of ways I'm going to ask pharm. It's a little bit more straightforward. It's also just understanding it and not memorizing it. So very important to do that. So the first couple of topics we're going to do, we're going to just jump into dosages is good for med math. Good job. So now we'll do some practice questions, but I'm going to scroll very slowly because I don't want you to start throwing out answers. But look at the first subject that I've chosen. The first one is, and we use the method here. If you can't see, actually, let me just scroll up. It's all good. So if you're looking at the method, select all that apply. Okay, now I'm thinking one of the 4 types of select all that apply. And if I'm looking at 4 types of select all that apply, I know I'm looking at risk factors, I'm looking at education, I'm looking at signs and symptoms, I'm looking at concepts. So right now, I'm already into a different zone right now. Right now, I didn't even look at the question. I just know that I'm looking for one of those 4 things because it is a select all that apply. It is a select all that apply. So now I read the situation because that's the method. A nurse is providing education. Look, I already told you, select all that apply, right? Education to a client. Now I just got to figure out what we're going to educate them, right? Prescribed furosemide, a loop diuretic. So which statements by the client indicate understanding? So yeah, it is education. It is one of the 4 types of, what's it called? Select all that apply. So now, let me just move this real quick out of my way. Sorry, the little cursor was getting in my way. So now, do we start from the top and just start going at it? No, we always start from the bottom. And in this situation, because it is a select all that apply, we start from the bottom and we make a decision, right? Essentially, select all apply, we can go true or false, right? So I should expect some weight gain as a normal side effect. But wait a minute, what type of a drug are we talking about? Diuretic. In heart failure, what do we do? In heart failure, we actually gain weight. In heart failure, we gain weight. But in diuretics, we're losing fluid. We're losing fluid, right? So we're going to say false to this one. Sorry, if I get winded, I apologize. I need to report any ringing in my ears to my healthcare provider. Ooh, tinnitus, ototoxicity. Oh, dang. If you don't know that mnemonic, it is a quick tip. But yes, to my students that know that, 100%. I should take this medication in the evening to avoid waking up at night. Only if you don't like your patient, you tell them to do that, right? So that way they're peeing all night long. But no, we like this patient at this point. I may need to take a potassium supplement. Well, what are we thinking? Oh, dang. We think about hypokalemia, right? Hypokalemia. So yeah, that may be a possibility. Then I should avoid foods in high potassium. Well, isn't that kind of just saying the opposite? So if I kept 3, then by default, I get rid of 2. By default, I get rid of 2. And then I need to monitor my blood pressure regularly. Absolutely. So 1, 3, 5. But look at what, again, pharm. Where did I come up with this question? I came up with it because of heart failure. We learned about heart failure in depth, especially those that are on course or on demand. You know how heavy I go into heart failure. Then we go progressively into the treatment. And then from the treatment, we learn about the medications. Thank you, I appreciate that. And then we go into the medications. And then we go into the different types. Okay, identifying. Okay, I can identify a loop diuretic. Okay, that wasn't the question though, but at least I identified it, right? Thank you, I appreciate that. And then we look at side effects. Well, we learned ODAing, right? And then we learn about educating them about ODAing. So really, there's not a lot to pharm, but it's at least I know where in the progression it lies. I identified whether it's right-sided, left-sided, or complete heart failure. That was the first thing that we did, right? Then from there, we were able to clinically diagnose it, but then we had to confirm the diagnosis. You see the progression, and then we went right into drugs. And we went right into drugs. And then we left off at the end of heart failure, educating them, right? So yeah, if you learn it in order, you're gonna understand where different drugs lie, So let's see how we did. And there you go. Whew, okay. I haven't talked like this in like 2.5 weeks. All right. So again, we stick to the method. Select all that apply. Which of the following, or sorry, a nurse providing education, okay, we knew, select all that apply. It's got to be education, risk factors, signs and symptoms, so on and so forth, right? Prescribed a thiazide diuretic. Whoa, where did I come up with thiazide diuretic? Which of the following should be included in the teachings? Thiazide diuretic. We're looking at same situation, right? We went through heart failure and we learned about different things. We learned about different drugs. So very important that we understand that again, that we must understand the progression. So again, all we're doing is we're educating about thiazides. So avoid prolonged exposure to sunlight. What do you think about this? And why? Wait a minute, hold on. Yes, good job. Sat for a photo. Again, another quick tip. If you, okay, Nurse Brittany, can you put in a link to the quick tips because we did stock up on them and they are going out. That's a quick tip, sat for a photo. If you do not know that thiazides are sulfa drugs, then you're not going to get that right. It's also content, right? Content. So yeah, absolutely. Monitor your weight regularly and report any significant changes. Well, what's the objective of a diuretic? It's to get fluid off. So again, just in heart failure, we're just thinking about heart failure and we're combining it with what we learned about drugs. So yeah, if I have any changes, significant changes on top of that, look at the word. Now, take this medication at bedtime to avoid dizziness. Now look at what I did there. What did I do? I put in avoid dizziness, which is indicative of what? What could it be indicative of? Indicative of orthostatic hypotension. Yeah. But the problem is that this is a diuretic. So are we going to tell them to take it at bedtime? No, we're going to tell them to change positions slowly. So upon awakening, but then change positions slowly. So yeah, good job. You notice how, and this is a board favorite thing to do, okay? They'll put in one thing that's wrong and another thing that's right. You just got to understand and not breeze through it And then you just see avoid dizziness and you're like, okay, cool. You know? So again, very important that you read very carefully. You may experience muscle cramps as a side effect. Ooh, what is that? What is that talking about? What is that talking about? Potassium. Do we lose potassium with thiazides? Absolutely we do. Absolutely we do. So yeah, we also are looking at hypokalemia. Now look at this. Now think about this. Are loop diuretic sulfas? Yes. Thiazide sulfas? Yes. Hypokalemia in both? Yes. Oh, wait a minute. We've got options. We got options. So we're going to choose this one. Increase your intake of potassium-rich foods. So again, just like loop diuretics, what are we thinking here? Yeah. But you see where I went with it. I was already thinking, and not even on the question itself, I was already thinking, wait a minute, I know two drugs that are the popular diuretics that both have sulfa allergies and they both have hypokalemia. So there you go. There you go. So I've made a lot of them select all that apply just for educational purposes, just so I can give you more content. So this is not necessarily how they're always going to ask it. More than likely, there'll be a little bit more freebie. But wait a minute. What about, I've got furosemide here. I've got thiazide here. Hold on one second. I'm thinking of what? How about a case study? Or potassium sparing is a good answer. What if I started thinking, what other types of questions as I'm studying right now? A case study where now I've diagnosed what? One of the types of heart failure. And what am I going to do if I put thiazides and loop diuretics? What type of a question am I going to add to that case study? In the case study, I'm going to add in a matrix or a grid, because again, all that is a select all that apply. Do you think if I compared these two in a matrix or a grid, that's 100% a question? It is. It is. Which now leads me to, which of the following should nurse, or select all that apply, obviously. So now we're looking at which of the following nurse include for patient's education. We look at the situation, a 58-year-old with heart failure prescribed. Now we're looking at potassium sparing, right? Now we're looking at potassium sparing. So again, that's what I was saying, is potassium sparing, and those of you that watch me break it down in lecture, I mean in the course, understand how it works. Not even that it's potassium sparing, but how it works. Because what is it called? What is a class of drug? If you guys remember, RAS system, good, yeah, or RAA system. So aldosterone antagonist, good job, good job. So now I've got to look at the education on spironolactone now. Spironolactone. So now we go to, make sure I'm going in the right order. I am, okay. All right. So report any unusual bleeding or bruising to your healthcare provider. Is there anything that we talk about that has anything to do with bruising or bleeding regarding potassium sparing? No. It is safe to use salt substitutes while taking this medication. Well, what is a salt substitute typically made of? Potassium. So if we're using potassium sparing, do we want to increase potassium? No. You do not need to worry about kidney function tests while on this medication. It's a diuretic, right? We're focusing on the kidneys. Monitor for signs of hyperkalemia, such as muscle weakness or irregular heartbeat. Yeah, because which one of high potassium, low potassium in any of these three diuretics, what are we freaking out about? What is the number one thing that we're freaking out about? Yeah, VFib. We're worried about ask graph, the K in ask graph, right? Potassium, changes in potassium, not low, not high, but changes. So any of them, we're worried about it. So yes, I would agree with you all. Take the medication in the morning to prevent nocturia. Well, what is nocturia? Noct is what? Nighttime, urea, urination. So yeah, know your medical terminology as well too. So yeah, we want to take the medication in the morning so you're not peeing at nighttime. You should avoid foods high in potassium such as bananas and oranges. But wait, isn't banana vitamin K? No, it's not vitamin K. It's potassium, which symbol is K. Because where did I go with the banana right now? With the vitamin K mix up. What medication or did I go with that? Vitamin K, warfarin. Good job, good job. So you've got to think always. You always got to be thinking. And when you start thinking like this, when you just start making a little tie like this, bananas, potassium, wait a minute, I know that they will try to trick me with warfarin. You just make a little tie like that, and you're going to do just fine on the board exam. You're going to do just fine because you're making those ties. You're taking that step, that extra step, just to kind of look at it. Not that it's in the question, but just to look at it. So good job. Oh, why do we have this mark? That's incorrect, sorry. Okay. Continuing with some cardio farm, high yield cardio farm and education. Let's talk about some peds. Which of the following treatments is most appropriate to reduce risk of coronary artery aneurysm? Okay, I'm dealing with the coronary arteries. I'm scared. What's the situation? A 3-year-old diagnosed with Kawasaki's disease. All right, this is what type of a question? This is 100% a freebie question. Either you know it or you don't. Either you know it or you don't. But for those of you that are in the course, how much further do I want you to go with IVIG? It's not just about Kawasaki's and high dose and IVIG. Yeah, we go way further into Kawasaki's, right? We talk about lab values, right? We talk about vasculitis. We talk about all the live vaccines. So there's so much more. There's so much more that's involved, but this is just a scratch the surface on farm. Scratch the surface on farm. I just want to make sure I'm not missing anything in my notes real quick. Sorry. Okay. Oh, okay, there we go. All right, let me make sure I didn't miss anything that I want to talk about. Missing IVIG, more stone. Yep. Okay. Cool. All right. Perfect. So again, very important that we understand beyond just this. This is scratch the surface. This is a great question to know because it's a freebie question. But you need to take Kawasaki's disease and just in general coronary arteries and IVIG and how aspirin works. Whoa, there's a lot more that's entailed. So again, those of you that are answering the questions like even beyond, I love it. I love it. Okay. Isn't there a quick tip that I made up on live vaccines? I think there is a new one that I made up. Can somebody put it in there? I forgot what I made. I forgot what I made. So I think it was like mothers hate certain vaccines or something like that, or vaccines that mothers hate, something like that. So it's a quick tip that you should know as well too. Okay. Thank you. I appreciate it. I appreciate the compliment. I'm glad you guys like the quick tip book. I think it's golden. I think it's literally something that it's just a necessity. Which of the following statements by the parents indicates a correct understanding of medication? So what did I say? The different ways that we can ask. So we said further teaching, further intervention, further teaching, further intervention. With further teaching, further intervention, now we got to see what the situation is. A nurse is caring for a neonate diagnosed with a PDA. Did we talk about PDA in depth? We sure did. The neonatologist has prescribed endomethacin. Which of the following statements made by parents indicates a correct understanding? A correct understanding. So the one thing I don't go into is in too much depth. Nurse Megan goes into it a little bit with prostaglandins and in upper GI with ibuprofen and misoprostol, which has prost in it. So Nurse Megan goes into it pretty heavy with that. But I don't go into the prostaglandin portion of endomethacin, but we do talk about it when we do when Nurse Megan does upper GI. So, which of the following is a correct statement? Correct statement. So we don't need a further teaching, further intervention. This is straightforward, a freebie type of a question. Endomethacin is used to reduce pain caused by the patent ductus arteriosus. Well, can endomethacin be used to reduce pain? It's an NSAID, right? It's an NSAID. If it's an NSAID, can we decrease inflammation? Of course. So, but does the PDA cause pain? No. Not at all. Endomethacin is given to prevent infection in the ductus arteriosus. Prevent infection. Is there anything that I've taught about PDA that leads to any type of infectious process? No. The thing is that we've got this duct that's open, but it needs to close. So after how long should it close? You should know this. 3 days. Good. Endomethacin will help in expanding the ductus arteriosus to improve blood flow to the lungs. We're not trying to expand it. We're trying to close it. And with the PDA, what type of murmur are you going to hear? Loud machine. There you go. Endomethacin is used to close the ductus arteriosus by inhibiting prostaglandin synthesis, and that is, in fact, correct. And remember, you should always know beyond that. PDA, we go into heavy, and we educate our patients as well, too, on certain things that they should not be doing while they're pregnant. So a little maternity along with cardio. A little maternity with cardio. Okay, let's see where we're at now. Make sure I'm not missing anything. Okay. So notice how many different, like we're barely scratching the surface of cardio right now. Okay? Cardio is such a heavy topic, and I know I'll be teaching it to my my current course starting next week, but it is such a heavy topic that you won't even believe how much we've spent on it. So now we use the method. Which of the following statements by the patient indicates a need for further teaching? Okay, now we're looking for what? The wrong answer. The wrong answer. So a nurse is providing discharge teaching to a patient with CAD, coronary artery disease, who has been prescribed atorvastatin. We just identified what drug we need to know about. So what type of a drug is this? Because we talk about this one heavily. Yeah, it is lipid lowering, right? So now we start with number 4 and we say which one is wrong. I will have my liver function tested periodically while on this medication. Is that a wrong answer? We're looking for a statement that's wrong. So that's not a statement that's wrong. I can continue to drink grapefruit juice daily as a part of my diet. So do I choose it? That is a wrong answer. Okay. That's a wrong statement. Sorry, a wrong statement. I will report an unexplained muscle pain or weakness to my healthcare provider. That's a correct answer. And I should take this medication in the evening. All right, look at how many different things they tested on. Statins, do we need to know about LFTs? Yes. Statins, do we need to know about grapefruit juice? Yes. Statins, do we need to know about rhabdo? Yes. Statins, do we need to know about when to take it? Okay. Do we need to know how they work? Not necessarily. Do we need to know if they don't work, what we're going to do? Yes. You see, there's so many different things that I've already just thought of by looking at one question. So when you're doing your question bank, you really have to start thinking like this. You really have to start thinking like this. And that's when you're going to know you're ready. All right. Any questions while I drink some water? No, we're good. Continue. All right. Thank you. I really appreciate that. My whole team does. There's Megan in here, there's Brittany. I mean, we're out here writing questions and coming up with everything to help you pass. So again, just as a reminder, if you need to talk to me or Nurse Megan or to Nurse Brittany, fill out that Google form. We will gladly call you. And you do have to literally, I mean, every tutor is amazing in NCLEX High Yield, but you've got 2 of the ones that teach the course right now in here with you. Thank you. We really appreciate it. I'm sorry, I don't mean to go on a tangent, but I haven't talked to my students in like 2 weeks. So we really do appreciate the little things. It doesn't cost anything to post about us. It doesn't cost anything to like what's it called? Post or to spread the word, post it on Reddit. It doesn't cost anything, but we appreciate that more than anything. We really do appreciate that. It keeps us going for sure. All right. So now, which of the following instructions should the nurse include when teaching the patient about medication? So again, sorry, I'm getting a little bit winded. So give me 2 seconds. Whew. All right, here we go. Which of the following instructions should the nurse include when teaching the patient about this medication? So now we are teaching about what? The patient is prescribed sublingual nitroglycerin for the treatment of angina. Of the different administrative routes of this medication, of nitroglycerin, what's the most popular one that's going to be tested? sublingual, right? Sublingual. And good job, Patch. Good job. So now, which of the following are we going to teach them? Are we going to teach them to chew the tablet before swallowing? No, the administrative route is sublingual. What are the fastest ways to absorb the medication? Place the medication under your tongue until it dissolves. Yes. Swallow the tablet. No, this is a fairly easy question, but sometimes you're going to get some easy ones. Take the medication with a glass of water. So ultimately, knowing the different ways of administration, there's a lot more to nitroglycerin. Trust me, there's a lot more to nitroglycerin than this simple question. So it's very important to, again, go the extra mile. Go the extra mile, because these ones will pop up. Some easy questions. Oops. Hold on. There we go. So again, a fairly straightforward freebie question. Oh, here we go. Okay, let me make sure I didn't miss anything on that. Okay. Okay, cool. All right, a few more questions. Let's get through them. All right. Which of the following statements accurately describes the action of clopidogrel in this scenario? Okay, this one, right off the bat, identification. What is clopidogrel used for? It's an antiplatelet. Good. It's an antiplatelet. And the reason why we use an antiplatelet, tell me where we're going to use an antiplatelet. When do we need an antiplatelet? Stent. Yeah, stent. Why? These stents, platelets love gathering on them. Okay, so we've already started thinking ahead of the game right now. So now we figure out the situation. A patient undergoes a coronary stent placement, and the healthcare provider prescribes clopidogrel as a part of post-op regimen. Okay, so which of the following statements accurately describes clopidogrel in this scenario? So there's a lot when we talk about stent placement, right? Think about the notes. Percutaneous coronary intervention versus a coronary angioplasty versus coronary angiogram. Those are all terms that people mix up, right? People mix them up, and then when we go through it, you're like, whoa, okay, cool, this makes sense now, right? So, and then the treatment after, very important as well too. So we start with number 4, and we see which one is accurately describing the action of clopidogrel. Now, I said that action is not something, like mechanism of action is not something that is really going to be high yield. So I don't find this question high yield, but I do want you to identify clopidogrel and understand where it lies in heart or in cardio. But this is typically not going to be a question, but we'll go through it anyways, as we've put it in here as well too. So clopidogrel inhibits the enzyme cyclooxygenase, reducing the formation of thromboxane A2, or clopidogrel increases the production of prostacyclin, leading to vasodilation. Okay, now I'm really confused. Like, they just threw a bunch of stuff at me that I'm like, wait, whoa, this is one of those questions that if you get this one right and other people are missing this, you're doing really well. because people are going to get very confused because they're not going to know the mechanism of action. But ultimately, what do we say? It's an anti-platelet, right? So let's just try to find something that says platelet. That's the way I would look at this if I was taking the exam. So again, test taking strategies here more than the right answer. So I don't know, but I'm going to continue using the method. It prevents the formation of fibrin clots by inhibiting thrombin. Ooh, that looks like a good one. But again, these are ones that I'm throwing at students to throw them off because, again, not NCLEX High Yield, not NCLEX High Yield. Do you think that maybe fibrin clots and thrombin sounds like a right answer? Probably could, But we're still looking for something that says platelets because we know our test taking strategies. So now we go to number 1, clopidogrel decreases platelet aggregation. Okay, sounds a little bit more like up the alley of clopidogrel by irreversibly inhibiting the ADP receptor. So again, where do we think we're at with this question and why? We're going with 1 because the word platelet aggregation is what it does. It decreases platelet aggregation. But a lot of people are going to choose either 2, 3, or 4. If we add the stats on it, I bet you it'd probably be about 30% on each one. 30% here, 30% here, and probably one of these is 30% as well too. All right, let's see if there's anything I missed on this one. Good on that one. We're good on that one. All right, here we go. I missed you guys, so it was great. I would do my usual "what is you doing," but I clearly look like this because I've been pretty bedridden for 2 weeks. So so I do appreciate everyone. Thank you all so much for coming. I apologize for being absent for a couple weeks. With that said, if I did anything to offend anybody, I apologize. If I can get better, please tell me. And then with that said, everyone, just all we ask is if you post about us, and again, if you need to talk to us, reach out. You can DM us on Instagram. You can DM us on Facebook. You can hit us up on TikTok. You can hit us up on literally any platform. You can email us at contact@NCLEX High Yield, and we will reach out to you. And again, I encourage, if you're taking your test and you're not in the current course, start with the on-demand. Get on the on-demand, and you can always upgrade. You can always upgrade. And this lecture, I'm gonna see how bad I look, and I'll put it up on YouTube. How bad I sound, how bad I look. But for those of you that joined, I hope you took notes and you're feeling better about pharm and better about just in general how to approach it as well too. So with that said, everyone, thank you so much for joining, and I will see you all next week.